It's happening.
Okay, we are live. Hello, America. Here we are with several of us with uninspiring office backgrounds. It is probably January 23rd. And no, as promised, we have brought you a real live actual reporter, Mario Aguilar. Am I saying your name right?
That's close enough.
Aguilar.
Oh yeah, whatever. Okay, literally.
Melissa's like, okay.
Yeah. Anyway,
she's all actually. Yeah. Well, actually,
we are very excited. We are very excited to have Mario with us. So, yeah, Melissa sometimes picks up the phone with her mom and like speaks very real Spanish. So yeah, yeah. Our moms are big. Well, Lisa's mom actually is a big part of our show. We talk about her often, but other moms too. So
talk about your mom too. By the way,
well, I was saying that generally.
We're saying that we're collectively, we talk about our moms.
Yeah, we talk about our moms a lot. I don't know. Mario, you can talk about your mom a lot in about 30 minutes, but quickly introduce yourselves to our million loyal fans who I'm sure are watching this, and then we'll bring you back in a little bit.
Sure. I'm a health technology reporter at STAT News, which if you're watching this show, hopefully you have heard of. We are a health and medicine publication. We are affiliated with the Boston Globe's media company, but we are our own thing. We're 10 years old, and I cover all kinds of health tech things. I just passed 5 years here, and I guess the interesting fun fact about me, which is not that fun, is that I'm not a doctor, don't pretend to be one, and I was a tech reporter before I got into all this health technology business for many, many years. So that used to be an excuse for why I don't know things, which is no longer like, it doesn't really work anymore because I've been doing this for 5 years now. But I still don't know anything. So
that's smart.
I don't know why you brought me here.
We don't either. So we'll find out later, and we hope it's going to be a good show. So Mario, we're going to send you the back here. See you soon. Melissa, anything exciting to report?
Nope, just here, living the dream, guys. All excited to hear about all the news that's going on.
Sponsor our shows. Talk about sponsoring your shows.
Sorry. Sponsor our shows. We're booking for Vive. I already have people for him. So guys, just hit me up, Melissa at healthtechtalkshow.com. And I will see you later.
All right. Thanks, Melissa. Off you go. Oh my gosh, Lisa. So I'm reporting live today. Okay, I'm not even reporting. I'm just talking on I am talking on the internet live today from the ASTO offices out here in Crystal City near the Pentagon, where I hung out with a lot of public health professionals, a lot of the public health associations for 2 days. So that's why I feel like the no measles from whatever show I was lost in this computer on really fits here. I do not have measles yet. So that's exciting news. Thank you, public health, for that. Lisa, anything exciting before we move on? You are also, where is your boring location? Is it the Innovator corporate headquarters?
Corporate headquarters. That's right. Downtown San Francisco, baby, on a Friday. Who am I?
So weird.
Yeah, no, I don't recommend it. You know what, guys? Having a job is a whole thing. I don't know if I recommend it. Love my colleagues, love what we're doing. Don't love having to be places at different times.
Anyway, here. So like, Max says, who made our graphics, said things are really heating up. So I
agree.
They're starting to reuse some previous graphics and just putting them together, which I appreciate. I mean, it's a lot to come up with new places to paste Lisa and my heads every week. So Thank you, Max, for your continued service. Okay, starting out, it looks like potentially our government won't shut down.
Listen, whenever Congress is like, remember us, I'm always like, no, I do not. What do you do? Who are you?
I think they're back, or they woke up, or they slept off their hangover. Like, I think they might be back.
I don't know, man. I don't know. I do know that there's not going to be, we're still not making any progress on the premiums, which I think we're just going to let that one go and just say, well, TBD. I think I read something, maybe it's in your notes here, that I think United Healthcare was like, we will make no money on ACA plans happily. But TBD and all that still nothing.
Yeah, I think United said they're gonna if they make any money on the exchange plans, there'll be rebates back to their members in the exchange plans.
Hope so.
cool. That's cool. I'd be interested to know like if there was ever any money made there, and if this is just something where they're like, we never made money anyway, like whatever.
Kat.
I
Kat,
don't know.
Kat,
I don't
Kat.
know. Math is
Kat,
interesting.
here's the
Lisa.
thing. Take a look at the old balance sheet and the earnings per share on some of these companies. I think they're doing just fine.
Yeah, but the math is weird. Like they lose money but make money at the same
The math is
time.
weird on purpose, just like PBMs. For me, whenever I hear like the phrase like net pricing, gross pricing, I just like zone out. My brain like shuts down and I'm like, I think you're trying to trick me and I don't know how.
Yeah. Well, so there was this big hearing. All the plans were there, all the health plans, and the Democrats said, "Oh, it's not your fault. It's the Republicans' fault." And the Republicans were like, "It's the Democrats' fault." And it sounds like the plans were just like, "Oh, so are you saying it's our fault, or?"
If there's any like really like well-worn tradition in healthcare, the business of healthcare now and the government of healthcare, it's like pointing the finger.
The Spider-Man graphic.
The Spider-Man graphic. Everyone
Yeah.
is bad except for me. I'm good.
Yeah, I'm one of the good guys.
I'm one of the good guys.
Other interesting things going on in this bill, though. Our friend Josh Kaplan, Academy Health, AHRQ, AHRQ, the Agency for Healthcare Research and Quality, was basically like abolished in April. Hasn't been moving at all. There was like basically a $0 budget item on all the internal plans that were leaked last year about the reorganization of HHS. And it looks like in this new bill, which hopefully happens, they have just a small haircut from their 2024 levels. So
someone who actually knows about pharma pricing agrees with me and pharma interop.
Net to gross.
Exactly.
Listen,
See?
I love that they can lose money and make money all at the same time. I would like to know how to do that. If I lose money, I actually lose money. I don't know. It's so weird. Anyway, so that's exciting stuff. Sounds like Congress might be back. It's unclear what's going on. Also here, many of the agencies are only taking small haircuts as compared to definitely compared to what the 2025 rumors were. CDC looks like it's got like $9 billion. That's not bad because it basically got rocked. Something like a 40% cut. Also interesting that the SAMHSA cuts from last week that were reversed were allegedly a part of the move to smash it into AHA, the Administration for Healthy America, which does not yet exist. I think Trump asked for $20 billion. It is not in the bill. And I think you can see here, which I kind of can't, basically, Tammy Baldwin said, we can't actually acknowledge that request because there is no detail beyond that you need $20 billion for it.
I mean, this to be fair, I agree. I also would like 20 billion for me to not tell anyone what I wanted to do with it. That's also how I would approach it.
Yeah. It says it makes it impossible to consider funding through the appropriations process because HHS has not provided details. Oh man, yeah.
I know what it's gonna do. We're gonna do beef tallow, and that's fine.
Listen, I hear it's great for your skin. Okay, and exciting news that happened today. Lisa sent this to me, and she was like, "What? Epic! Like smash down!" So. This is not from Epic, but y'all, it's basically from Epic. Lisa, tell us more.
Oh man, I love waking up to new news. Basically, like as we know, there was the lawsuit last week. I think it was last week. Epic suing Health Gorilla, alleging that they were enabling allegedly criminal actors to get health data from these health systems through the national networks and then use them for other purposes and monetize them. Again, this is all allegedly, etc., all accused, suspected, all those things, right? And so then a follow-up to that is that Epic then continued to, we believe Epic, continued to write all of their customers and say, hey guys, like we have a big problem with the national networks. Let us together demand that our great federal regulators do something. Yeah. And so a big old list of lots of really big and significant health systems and similar players, including KeyCare, by the way. KeyCare, Ocean, who were also Ocean was part of the lawsuit previously, all writing this letter saying you need to clean house around the governance of the national networks. It is a very specific letter. We actually have our hands on it now, and it's really pushing on the governance of TEFCA and the governance of the national networks through, and it's also addressed to Steve Posnack, but also addressed to Marianne Yeager and the Sequoia Project. So
can we see this? Am I sharing my screen right? Oh, yep.
I just saw it. Go back.
Yeah, right here.
Make it bigger.
This
there you go.
There we go. This is yesterday. Marianne.
Yesterday? Oh yeah. Yesterday.
Yeah, I think so. Yeah. So I don't know. Our amazing fake reporting
vetting,
skills.
onboarding,
central
monitoring,
onboarding, false representations,
fraud, audits.
OMG, so good. I mean, I agree. Like, I actually agree with like pretty much all their demands.
Data retention policies of
intermediaries.
intermediaries.
Yeah, that's a really good one, right?
Because
that's like, hey, Q-hins, some of whom, frankly, are like kind of sewer rats. Like the reason they're Q-hins is because they couldn't make money. This is like Kat's vibe.
Everyone, please know this is Kat McDavitt.
This is not real. This is not real. But a lot of them, not all of them. Like some of them, it's like cost of doing business. But some of them got into this because they're making money on secondary use, aka data retention and reselling. Just to be clear, so I freaking love that. I mean, again, it's allowed, but I think people knowing which Q-hins are doing this is like that's important. Issue resolution. Like, this all seems great.
Pat, it's not important because if you have a node on the network that is an open network where everything can go to every Q-hin, then no. If you have one or two Q-hins who's doing a type of secondary use or retention that is different than the other nodes in the network, your entire network is borked. Best thing I can say. You're welcome.
Thank you. I
appreciate that. Hope that coming out of your nose was helpful.
Yeah. Listen, nasal douching is important. I don't know. Okay, issue resolution. Also, like none of this. I don't think anyone. Are we mad about any of this, Lisa?
No.
Yeah.
I mean, again, like you have to. I don't know. Like, do I agree with like Epic, which we know is behind this? This is not me being like accusatory or like mean. I mean, I like there is a bit of a problem if Epic is, pushing the market in all these directions to not share data and to further perpetuate like, competitiveness between health systems that results in information blocking. All that aside, like nothing's wrong with this letter. I agree. And by the way, who's left holding the bag? Obviously patients whose data are being shared without their knowledge and being monetized. But also, by the way, you have health systems who are responsible for things like breaches, and there's, serious financial penalties and huge hassle around that. And they're like, how can we be held to like breach rules around HIPAA and you're just like wildly sharing this data with no oversight? I get it. I agree with them.
Yeah. Agree. And then we can see here 1 bazillion organizations at KeyCare, our
list.
Man Lyle.
Amazing list.
This. So yeah, it's a lot
of big guys. A lot of big guys.
It's not small. And then keep going. As you can see here at the bottom, CC Steve Posnack.
This is like that letter that like reversed the SAMHSA cuts where like everyone and their mother signed it.
Yeah. Do you think Epic watched our talk show when we were like, look at this guy, Alguida, who allegedly did the thing, although he says it was a team sport. Or you think they were like, you know what, we should also write a letter. We should write a letter with 1 million people on it. I'm sure they got that idea from our talk show 100%.
That's right. I agree.
Yeah. And to be clear, like, a lot of the big EHRs are Q-hins now, as in like a couple. The sewer rat, there's probably only a few sewer rats, but whatever. Really but anyway, I'm here for like knowing who's retaining data and why. Okay, well, back to our regularly scheduled fake reporting. So that happened also in Epic News. Lisa, you remember they got Texased, we went through a kind of a hilarious lawsuit, I think, from Texas. But I just want to read like some of the lines from Epic's statement in response. There's some name for this. I don't know how law stuff works, but
a motion to dismiss.
Yeah. The state's antitrust claims rest on product markets that are detached from commercial realities and cannot support any of its claims as a matter of law. I just really like it when they say stuff like that in these like very fancy ways. I'm really into it. Yeah. The petition seems to presume that antitrust laws obligate Epic to enable any third party that wishes to use Epic's technology, including to compete with Epic, to free ride on Epic's intellectual property and innovations, including decades worth of proprietary know-how underlying Epic software. Like, I just kind of love the vibes of these things.
It's pretty good.
We'll see what happens. I don't know enough about like law to know if they'll be able to get it dismissed. But like,
if you are an expert in the law, tell us what we should do here. Thanks.
Come on our show. Tell us what's actually happening because whatever. Oh yeah, the high tax back.
With the co-chairs having resigned, both Sarah DeSilve and Dr. Briggs, both truly experts in the space, resigned, and that's a bummer. But yeah, high tech is apparently back in action.
Yeah, did they? Yeah, so this was their email. They also both posted on the LinkedIn, which is the only place I see anything. But yeah, very much emphasized in both their statements and I guess in this email, which they didn't send to me. All individuals and communities across our nation. I think this is more of like a protest on health equity. Good for them. Yeah.
You know what? Stand behind your words.
Yeah. What is Epic's lawsuit? What you stand up for is what you stand for. I forget, like something like that. I don't remember.
Sure.
But it was good messaging. I'm here for it.
Very good.
Oh yeah. Listen, I don't have measles yet, but I might soon.
Yeah, this means basically that in case you forgot, like the U.S. had achieved basically we do not have measles here in the country anymore. The only measles cases are people who are literally flying into the country already having measles from a place where measles is spreading and where, there isn't a really good level of protection from vaccination and just no in-country spread. We have lost that now. So we are losing the measles elimination designation. That's not a good thing. Everybody should feel bad about that as far as I'm concerned. Measles is bad. Measles is not good.
Yeah.
That's all I can say. No measles.
Yeah, I agree. Also, apparently, they're saying we don't need the polio shot anymore.
Okay, so on that one, if we don't give the polio shot, then I gotta say we deserve what's coming to us. Stupidity, disability that is totally unnecessary, real pain and suffering for children, for adults. I mean, freaking Mitch McConnell, that dude was a polio kid. If you like iron lungs, well, then I don't like you.
I don't. Sorry. I will also just say, like, any Americans who are interested in Lisa and my thoughts and feelings on this, thank you for tuning in. I would just like to say, as a parent of children, you still have the right to say you want the old vaccine schedule, right? Like,
don't be confused. You can get all the vaccines.
This is not a law. This is not a law. This is not a mandate. This is, and we, even when everything was recommended, you still as a parent could say you don't want it. You can still make those choices now with your physician. God bless America.
That's right.
Yeah.
Please.
Oh yeah, new model. We have so many new models. Lisa, tell us.
This is not even new anymore, Kat. You've already missed all the new models. There were 7 models announced by the end of 2025.
I just went through Health Tech Nerds and looked at what was recently posted.
Yeah. So there's Globe, Guard. I just forgot the other ones. Hang on. There's so many of them. There's a Medicare Part B model on Most Favored Nation pricing. There's a Medicare Part D model on Most Favored Nation pricing. There's a Medicare and Medicaid model on GLP-1 pricing. Then there's also a model on benchmark Most Favored Nation pricing for Medicaid. It's called like Globe, Guard. Gosh darn it! There's these freaking acronyms. They just keep hitting me. There's
like a lot.
I'll tell you right now. Hang on, I got it right here. It's coming right
up. You got it in your notes.
It's coming right up. The models are Guard, Balance, Globe. There's another Generous. Generous is the Medicaid
Generous
one.
Yeah.
Generous, Globe is the Part B one, Guard is the Part D one, Balance is the GLP one, Most Favored Nation pricing, and that's for Medicare, Medicaid, and other programs as well. So truly, the list goes on. They've just been pushing them out the door. And people keep asking me, like, what's going on? I'm like, no, it's really unprecedented. And the reason for this is that, yes, they had a huge cut in staff, as we know, early administration, but they have lots and lots of goals, and they have a very limited time to get all of these things done. If you don't know, most administrations only have the first 2 years, maybe even a little bit less, to get things done before the midterms. And the administration, the Trump administration, the leaders there, they absolutely know that. Yes, Blake, Maha Elevate is one of the other new models, but it is not something that I am personally too concerned about. Maha Elevate is probably just going to be used to pay for CBD.
It sounds like a weed store too. Like it sounds like a weed store.
It sounds like a weed store, and it's going to be paid. It's going to be used to pay for CBD and like ice baths or whatever. Cold plunge. Cold plunge and ice bath.
I love contrast therapy, so
yeah, perfect.
I'm here for that. That's great. Yeah. Also, can I just say, I feel like CMMI has like stepped up their weird naming game. Like,
I love it.
Like, think about like some of the boring ones. MSSP.
Love it so much.
Like what? And now we have all these Elevate,
I'm into it.
Stuff. Like whatever.
I'm into it.
Yeah, it could be worse.
Big fan.
Just a note that I think Lisa and I both saw on X from DepSec Jim O'Neill, just talking about the AI. There's just a lot of support for AI in this administration. And we're going to have a special guest, I think actually next week, some investor friend of ours who was giving us the dirty dirt about how venture capital is advocating for changes broadly to increase the adoption of AI, which is an administrative priority. So we'll get to that. But Lisa, any thoughts generally on this statement?
No, I have no thoughts whatsoever.
No thoughts.
I mean, listen, like
said Lisa never.
Okay, I was lying. I guess I would just say I do think that there are some things we can do. I also think that the guardrails you need to put up in place to use AI tools in clinical care is real high. Does this sound like a good idea? Right? Refill prescriptions? Could be. I hope the guardrails are right.
Yeah, we'll see.
Like I'll give you an example. Like you can't. And I don't think that this pilot does this. I do think that they do have these guardrails in place. But like, there's a reason why you wouldn't refill a prescription for someone. Like if they had a serious medical event in the meantime. My worry about AI tools is not that like we can't do it. It's that we don't have all the right data connected, right? Like how are you going to know? Did you do like a sweep of like all of the admission, discharge, and transfer alerts from all the possible hospitals that person could have been, seen at in the last month or whatever? Because you need to know that. And by the way, when you do have that conversation, at least someone asks like, hey, like, did anything happen with your health? Like, or did you like have any events? Did you go to the doctor? Did you go to the hospital? Were you admitted to the hospital? Like, there are lots of caveats. There are lots of, it's safe except for if,
Yeah. Well, right. I guess what margin of error are we willing to accommodate?
I don't know. I
don't know. Anyway.
Don't really know.
I just saw this on Health Tech Nerds too. Interesting tidbit. Lisa.
I'm gonna not say a thing, but I feel strongly that every human being deserves to be safe, healthy, fed, housed, and free.
Yeah, God bless America. We are free, allegedly.
God bless America.
Well, I mean, we only have the headline here, and obviously I didn't actually read the article, but I think it's more providers are still providing care. They're just not getting paid to do it.
Yeah. That's,
which is awful.
All these things are bad. All these things are bad.
Not great. Plans are good. So some new like actual business news. This is not Amazon One Medical specifically having this new AI assistant is new, but like generally we've been seeing a lot of this pop up. Yeah, I guess
I haven't actually tried it yet, and I am.
Well, yeah, you have. Yeah.
Hang on a second.
Yeah.
We're gonna do this live. We're gonna do this live.
What are you gonna ask it?
Okay. Oh, meet your new personal health assistant.
Can you say, please?
Here she is.
Prescribe me something.
What do I do? Okay, let's do this live. Let's allow access to the. Okay, please refill my prescription.
What's gonna happen?
Okay,
what's it gonna
let
say?
me help with that, Lisa.
Oh my goodness!
Oh, getting your medications.
Is this like your statin? That's definitely fake.
100%. Checking with Amazon Pharmacy. Oh, it goes through Amazon Pharmacy. They're like, let me put you in the Amazon.
They're gonna keep it under control. Oh, that's
You're
hard.
so right. Oh my God. I can help you refill your prescriptions. I see you're
Oh my
currently
God.
taking rosuvastatin.
You should
Both
say,
medicine.
my co-host on my talk show says that statins aren't real. What are your thoughts?
So it tells me both medications are available for renewal. Your preferred pharmacy is CVS, blah, blah, blah. And then this AI is already doing ads, baby. I also wanted to let you know that both medications are available through Amazon Pharmacy with a 2 to 3 day delivery to your zip code
That's
after
what
your
I'm
order is
talking
placed.
about.
Dang. And it gives me the
Ah.
pricing.
Wow, that's good. Okay, so
Okay, well, this is already advertising. We are already in the AI is advertising to me world.
Amazon One Medical, sponsor our show.
All right, well, I have to say, I did just like totally off the cuff, being just a jerk, was like, refill my prescription. It was like, will
You got
do.
this, girl. Yeah. Okay, well, that's
Okay.
a great review.
We did it live.
Yeah, that was fantastic. Okay, so Pair Team, we like these guys. They originally were doing a lot of CHW stuff. I think that's still mostly what they're doing, but also in AI news, they have acquired Town Square. I have no idea. I didn't until I read this press release what Town Square was or did. That sounds exciting. We like Neil, their CEO. Congratulations. Lisa, do you know anything about this?
I mean, I would just say I think they do really good work, and they've been out there in the space. They haven't been active for that long, but they have really been one of the companies that's been pushing on this, like, how do we get community health workers to be part of the delivery system, the risk system, the rural care system? Like, I like support her. As we noted, I think that these guys were presenting in Alaska at the was that Pear Team or Pear Suite? I was getting mixed up.
This,
Damn it.
this is Pair Team. This is Neil Batlavala, I think is his last name. I think Colby.
Was it Pear Suite or Pear Team?
Colby is Pair Suite.
They need to all change their names.
I know.
I can't keep
track. It's very difficult.
Anyway, they're in the same space, which is cool for them. But like generally that category, like I'm supportive of the idea.
Yeah, absolutely. I do wonder, and apparently, someone's buying. Change your names, please. Someone is like clearly like they have money to buy stuff, which is cool. Although I know this might be a losing money plus also getting money at the same time math problem, like Pooja just educated us on. Whatever she said, net to gross something. But I do wonder, this was like very much, this CHW thing was very much like Biden era money. And I have heard from a bunch of investors that like for things like HRSN, social determinants, like all that community health stuff, there's not a lot of money for it right now. So I do wonder.
That's a stupid perspective for all kinds of reasons. But
thanks, Lisa.
Not your perspective, but you weren't talking about what you think about it. It's stupid of those investors because this is absolutely a way to like truly like drive costs down and keep people out of the emergency room. Like that's just what
I agree.
Right? It has to like if you think about it like that, cool. You can say like, oh, it's about health equity and meeting communities. But sure, absolutely. As we know, like say this, not that. Use the right words that work with the people who have the money and have the power right now. Like don't get hung up on talking about how it's like community appropriate care and health equity driving resources or whatever. Talk about how this is going to keep people out of the emergency room by bringing care to their homes or whatever it is, right?
Yeah.
Like do whatever language gymnastics you have to do because this is a good idea.
Yeah, no, it's totally a good idea. And to that point, I think, I just spent a lot of days with some really hardcore public health people and including people like on the ground practitioners. And it was pretty amazing how, especially the on the ground people were like, yeah, like all of our funding it was, I think, very similar to Matt Christensen, who we had on the show from West Virginia, talking about like, we've always been broke in West Virginia. We're just going to figure it out. Like really scrappy approaches to, okay, like how can we keep funding things that are really important? Like, like public health maybe is not the word that's super popular right now. How do we actually bill for some of these services? Things like that. Like, I think to your point, Lisa, that is something that scrappy, dedicated people figure out.
Yeah, it's by the way, it's not like community health workers are particularly highly paid resource. They are people who are like kind of subclinical. They're not really a licensed clinician. They often are from the communities that they are representing and the people that they're working with. This is the kind of activation you want to do of people who can support the patients and the members of the community where they are, keep people out of the ER, provide appropriate care, all those things that are really important.
Yeah, totally. Okay. Quick little announcements. We will be at the ASTP meeting. It's going to be great. Hopefully everybody's going to go because this is going to be the coolest nerd show of 2026, probably.
I will be jet lagged beyond belief, but that will be hilarious because I'm trying to make everyone around me believe that that jet lag is fake, including myself. So we'll see.
Yeah. You do seem to rally. Are you flying? Are you red-eyeing in that morning?
I am flying from Switzerland right before that. So good luck to me, like I said. Good luck to me.
Okay.
If you see me, hand me a Celsius. By the way, if I have 3 Celsius, I die. So like, be careful.
Oh my gosh.
Like I might just die.
Oh my gosh. Well, that's great.
It's gonna be great.
Yeah, I don't know. That stuff's probably gonna kill you, but
it will. It will.
Also, I know Melissa said we're booking for Vive NHIMS. That is true, but we only got a slide made for Vive so far. So we will be there. Come and say hello to us. I think we're both moderating stuff.
Yeah. On Sunday, I'm moderating something. I don't think Pooja is actually on the panel, but it is in her area of the world around pharma interop, as far as I recall.
Oh, that's awesome.
So that was very nice. And then TBD on other stuff. Are you moderating something else as well, Kat?
Yeah, I'm moderating. I don't actually know what it is, but it's going to be awesome.
She's going to do something. Everyone.
And I just did not read the description fully, but it's basically like hospitals surviving in a time of super slim to zero margin. So it's going to be awesome. And if I had read that description well, I would even tell you who the amazing speakers are, but they are very fancy people. So I also do not remember the time or date, but I'll be there, and as will the talk show and Melissa.
This is the thing, everyone, as you probably know, like you could put myself or Kat down in a room and we would just like jazz hands our way like out of there. Like we'll figure it out.
We'll just figure it out. It's going to be great. Also, we have so much time to prepare, so not totally worried. So we will be there. We are going to switch over to our real reporter who knows how reporting works. Let's find him down here. Oh my goodness. Mario, I know you've watched our show every Friday for 2 years, but what did you think since you actually probably haven't?
I've watched it many times. I can't say I've watched every episode. Friday afternoon is either for me a total nightmare because I'm trying to not ruin my weekend with a story that needs to get done, or like, yeah, let's just leave it at that. There are other versions of my Fridays, but which are related to maybe having worked very hard in a week and not having a deadline. And so
great.
But yeah, I thought it was very interesting. On the topic, I was about to be like, I was trying to like unmute to jump in and be like, if anybody has the the dirt on Epic on all this, because as reporters, we can't just assert things we sort of suspect are true. We have to.
Oh, you can't.
That's why we can't be
like find them out and confirm them. But then I was like, well, it really is epic. And so I was messaging Brittany, who wrote our story about this, and then she's like, look at my story, dude. They confirmed it. She was like, they told us a collaboration of the Epic community was coordinated through the Epic Health Policy Work Group, which is an informal group of organizations. So yeah, they did do it. Basically is what they're saying there. But I almost asked for gossip that was not gossip at all. Seems like Epic did it. Yeah.
I don't think it's a secret, and because again, obviously it's very well aligned with their lawsuit, and understand, right? If you had a list of your provider systems, your customers that big are willing to sign that letter, like, more power to you.
Yeah, I'm here for it.
Yeah.
Hey, Mario.
But what's up?
Hey, what was your hardest story of 2025?
Hardest. The one that took the longest was my profile of your buddy Chris Klump. That one took like months.
Weird.
I think that was going to be released for a long time, and then it wasn't released for a long time. It was rumored to be released for a long time.
I don't know.
That story?
Yeah.
The story? I mean, I was working on it for a long time, and I was, it proved it was just I had to nail some things down, and sometimes it takes time to do that.
Yeah.
I don't know why I didn't talk to you, Kat, for that story, but I probably should have.
Interesting.
No,
Huh.
I don't think you need. I don't think you needed to. Yeah.
But yes, it was that story was took a very long time to do, and
no, you shouldn't have talked to me because like Chris is like legitimately one of my best friends, and I would have.
She was biased.
I would have.
Of course, everyone is biased, so you're just balancing their different levels of biases. I assume at all times.
Yeah, I will say, he'll probably get mad at me for saying this. The picture you guys used, like he looked like he was like 22.
The problem
it is a real picture.
The problem is that if you I know, and that's one of the it's a long story. It's a long story, but if you don't have sometimes when you don't have the participation of the subject of a profile, it's hard to get a photo that you have rights to use in a story.
Yep.
Yeah. We don't know anything about that, as you can see. We probably
just use whatever photo we can find. We don't even care.
We've got stuff copied out of STAT. Yeah, I don't know. I hope we don't get any.
We pay for media liability insurance and hope that it covers us.
Yeah, we also only have. Oh yeah. Well, once in a while we get a cease and desist from sharing our opinions.
That's why I say allegedly all the time, because I believe in this like mythical thing that will protect me, which is not true, but I like
it. It's so funny. It is really funny that you guys are getting cease and desist. I would say, get comparatively few of those, but maybe I do personally. I don't get very many.
What I think is great is that people give a shit enough about our fake internet TV show to send us cease and desist letters.
That's an endorsement. Like we should just write like thanks for being a fan. Like it's
thanks for being a fan of the show. This is a fake company. We also don't have any money, so I guess like whatever. But okay, so that was the one that like took the longest. Like, what was there like a hardest one or like?
In the last year, gosh, I should have better answers for this stuff. But the one of the problems with being a reporter is that like the second you hit publish on a story, you immediately forget everything that was in it.
Totally, you're
like it just vanishes from your brain, and I'm like, and I'm on to the next. It's one of the reasons people are like, Mario, why don't you write a book? It's like I can barely concentrate long enough to do a story that takes 2 weeks long. Like, can I imagine writing? A friend of mine is a novelist and worked on his last book for 8 years. It sounds awful. So, awful. But I don't know, man. I think sometimes the clinical like stories where you're really diving into clinical evidence are extremely challenging because I try to be fair, and sometimes things kind of look like they're working, but they're not. You suspect they aren't working. You've got to make sure you really understand it, which sometimes requires a level of statistical understanding that I don't have readily at my disposal. And so you really have to talk to a lot of people to get those nail those kinds of things down. But also those stories are really fun. Like I wrote a kind of in-depth story on this company Slingshot AI, like the therapy bot company, who they published some evidence last year, which was kind of my sources suggested was not very convincing in any way that it proved anything. And but it's fun to dive into that. Every year Apple puts out some kind of product, and I always like to sort of look at what data they publish about. They released this hypertension notification, which I've been using for 6 months now, and I haven't gotten one. So apparently my hypertension doesn't exist, even though it probably is there. But it's interesting to look into the sort of what the evidence says about those different features, and like do they work? What will be their actual impact in society if they are, multiplied by a scale of, hundreds or tens of millions of people? So yeah, those are fun. Those are fun stories. I got to go out to Apple for that event last year, which is like a entertaining experience to have.
Right on.
What do you think about Apple giving up on AI and just being like, Google, run everything for us?
It's a debatable position to take. I think at this point in their development, it's a reasonable like comparative advantage calculation. Like we didn't invest all this money and we're a little bit behind on this. It also, if you buy the argument that maybe LLMs aren't all they're cracked up to be, they're probably totally fine to let Meta and Google spend hundreds of billions of dollars of their capital developing all this stuff only for it to not make any money in 10 years and they didn't spend that money. So I think if they really felt like there was a compelling reason to do it, they would. If you look at companies like Facebook and Google, Meta and Google, I've been covering Facebook since it was actually called Facebook, but like they have a lot of the data, they have a lot of really interesting data that they can throw at this development, right? And I don't think that Apple necessarily has that like an advantage on any of that data. So if they went in to develop their own models, like what would they use to train them? The same stuff that everybody else has access to. Like what's their advantage, right, on that front?
Yeah.
And they've done perfectly fine, like not having a search engine. Like it didn't end up being a huge disadvantage for them. Their business model isn't based on any kind of data collection or I don't know. It seems like a reasonable position from a tech perspective, but and like business perspective. And I think they don't want to spend. Do you really want to spend $150 billion developing a competitor? Like, I don't think so. Like, that's
and they're also dramatic too. I mean, it's hard to not follow the like AI bro drama with like thinking machines, and it's just it's such a mess. And you look across those guys and you're like, what's going on?
I mean, I don't think the drama is what's keeping them away. Like, they've got you got to have an iron backbone to be at the helm of a $1 trillion company. So I don't think they're afraid of getting into a fight over something. And they are sort of famous for entering things late and beating the pants off everyone else. So maybe they've got a plan there. But yeah, do you really think that there's enough of a credible difference between the performance of Claude and the GPT models to justify investing in a possible competitor that differentiates? Like, I don't know.
Yeah. Good point.
Yeah,
I agree.
Hey, so I mean, we want to hear your like thoughts and feelings on all the things. Like, we want to know like what topic you're super interested in, like all those things. Do you think? I was talking to a reporter. I'm in DC. I was talking to a reporter a couple days ago, and she was saying, she's like, this administration is like so open. Do you feel that way? Was it easier to get the deets in the Biden administration? Do you feel like the Trump administration talks to you?
No. The look, I covered less policy during the Biden administration than I do now. I think I got I do a lot of talking to like the FDA, and the FDA never says anything, so like you get a very like sanitized statement. I did get interviews for some stories from the Biden FDA. I haven't gotten anything from this FDA. I'm not our main FDA reporter, right? But I do cover med device policy sort of a lot, and they haven't gone on the record with anything. So no. Some are a little more open. ASTP kind of like plays ball a little more, but I haven't gotten like, I'm still waiting on my Tom Keene interview. I don't think they're very open. I mean, we wrote a whole thing about how CMS is like not held very many press briefings at all, or like doesn't really talk to us about much. So
Yeah, well,
I would
that's true. A
say
lot of
my personal opinion is that no, I'm not hearing very much from the administration. When I get like a little sentence here and there explaining something, but I don't get like a full interview.
That's true, because I think a lot of the events that Lisa and I go to, like when they invite the clown show, and they, I'm on the list, they don't invite press anymore.
The clown show is like people like us, like people who are we're not journalists. We don't report real news. We do like know things and we talk to people, but we're not held to any journalistic standards because we are fake news, and we also just have other interests and other stuff we do.
We have been told we are not attending. It was not always, but they're like, you are not attending as whatever the hell the talk show is, right? You're attending in your professional capacities, but yeah.
I mean, I think it's confirmed at this point, but like Chris we're gonna have Chris on at our event in a couple of months in March. So like Chris Klomp. So that will be an exciting on the record opportunity for us. And they're obviously doing a lot of public outreach, like public presentations. They were all over JPM, they were at CES, and like I think they take a limited number of questions in those contexts, but in terms of like a real on the record interview with anybody, it hadn't happened for me, and I don't think for any of my colleagues.
Yeah, well, that's true.
In limited ways, limited capacities. We had the NCI director this week. Like there are some people who talk, but it's pretty limited.
Yeah, and like even hearing what you're saying, this reporter, like it was all like random stuff where she bumped into them and like asked questions, and it was nothing like official. So I think it was
it's
just
like the president on Air Force One with the yelling at like you could just like get in there.
So I don't know, and I don't want to speak for all of my colleagues because there's a whole team in DC that like I think has their contacts in various departments. So it's not like it's radio silence, but if you have not seen an RFK Jr. interview on statnews.com, nor a Dr. Oz interview, nor a Chris Klomp interview, nor Abe Sutton, Mario Macari, however you want to say it, none of these people have sat for interviews.
Makes sense. Well, let me ask you one more like how real media works question, and then we want to ask you about like what you think about like what's actually happening in the real world with all the news. So like the number of stat news, so I'm actually I actually subscribe to Plus. I'm like one of those people. The number of notifications I get from you, Politico, everyone in the past year, like how are you guys keeping up? Like is it just like 24/7 like crazy time all the time?
Are you talking specifically about the policy people? I mean, they've been our team in DC, which we have a whole DC based policy team, and sort of some of the biotech and business people are involved in that coverage as well, who are scattered around the country, have been working extraordinarily hard. On the health tech team, we've also been covering the administration a good amount. There's less sort of like high level news for us there, but how do we keep up? I don't know. You'd have to ask them. I am actually personally trying to figure out how to keep up with all of the news that I need to like read to, theoretically be informed enough about my job. It is very hard. At one point in my career, I devoted like a solid hour to reading that stuff every day. I don't have that kind of time anymore. It's just too busy. So like,
you just need to get on Slack with Lisa. That's how I get all my news. Like, I'm just like, it must be important.
I sort of trust I have sources who tell me things, and I sort of count on the news that is really important, sort of finding me sometimes. I have a lot of contacts who send me stuff, and I count on the news that's really important, sort of finding me sometimes, because there's just simply too much to keep up with. But I'm glad that you subscribe to STAT. We really appreciate it. Also, if anybody, my subs team will be mad. If you want to subscribe to STAT, I can help you. So get in touch with me.
Hook you up.
And,
you may not know this, Captain McDavid, but I also subscribe to Stat Plus. It's one of the only outlets I subscribe to. So,
Yeah,
because
we can
I'm a little cheap. I'm a little cheaper than Kat on that front, but I do actually subscribe to Step Plus.
Yeah, we
Real
can.
talk.
We're doing a lot of promotions these days. That's the way that you get people. And if there's not an active promotion when you reach out to me, there are things that can be done. So
Got the cheat
Reach out
codes.
to Mario.
yeah. There's I'll give you the special code.
Ooh,
Mm.
special
The secret
code.
code. Yeah, I
I
got
like
secret
it.
codes. If I was really slick, I would have had somebody make me a QR code that we could have flashed on the screen, but I didn't do all
Oh
that.
yeah, because
So
there's like at least like 100,000 people watching, so it would be
yeah,
too much for you
I
for
know.
sure if that happened.
Yeah.
Yeah. Okay. Hey, Lisa, do you have any like real life questions about?
I mean, those are my real life questions. I have stupid questions about, journalism, which is just something like, you were talking about the photos, and it's like people. It seems like people always have the tendency to blame the reporter or the person on the byline for like the photo of the person and also the headline. And like famously, those are
Hmm.
the two things that oftentimes the person who actually wrote the article doesn't have any control over. It's like, why did
It's
you say that? And you're
true.
like, that's not what the headline was. I didn't choose the
It's
picture.
true.
Like, whatever. What
It's
else do people
true.
get wrong about what's your fault versus what's like your editor's fault?
Those are common ones. I also like when people are mad about almost anything in a story, I just blame it on the editor. But
Oh
the
Nice,
yeah,
nice,
that's
nice, nice.
awesome.
and
Quality,
that's what they're
quality,
there for.
quality.
They're a
Take
human.
the blame.
They're a human shield. I don't know. In terms of misconceptions, you'd be surprised how many people actually believe that we are writing our articles with ChatGPT, which we are
Oh
not.
boy.
Like we're
Yeah. No.
100% not allowed to do that. The whole value prop of our business is that we are not doing that. And so people are actually shocked. I was at a conference in December where I was at a dinner afterwards, and this guy was just shocked, couldn't believe that we were writing this. And I had a big CEO of a major, really well-funded company be like, "Oh, I know. I just let it slide in the interview." He's like, "Well, he was just talking," and he's like, "Oh, I know. Well, we know that you guys write your stories with ChatGPT and then kind of fix them later." And I was like, this is not what I'm
No.
going to get into with you about right now. It's not what we're talking about, but yeah, that doesn't happen.
You're
So
like,
that I think
but I'm a
that's
writer.
yeah,
Like I
and we're
write for
not
a
allowed to
living.
do that, and we are not allowed to do that. And not only are we not allowed to do that, it turns out that I'm in this profession because writing is something I actually like to do.
Yeah, yeah,
It's fun for me most of the time, even though sometimes it's kind of hard to find the time. You reporting all the time, it's kind of hard to find the time to actually write the story. But I like writing, so. It's like a fun puzzle writing stories. So yeah.
yeah, yeah.
Um,
Well, what are you most excited about with all like what's a story that gets you super pumped? Like, what are you psyched about right now?
well, let's see. I think you guys were talking about the Doctronic story earlier in the show. I think that's going to be a big thing this year. I think we're gonna, and I may or may not have something about coming about that soon. But they, not them specifically, but just people really pushing the boundaries of where AI can go into care. As we say,
Right.
the administration is all about this. And I don't think even when it runs afoul of probably the way that regulations are written, that the administration is going to get in the way. I think they're going to enable it. And I think they're going to let, as we saw with Whoop, where there are boundaries, they are going to help remove them and maybe occasionally like exercise their totally legal ability to decide not to enforce stuff. So like so I think
Right.
that's going to be a really interesting thing. I've covered mental health technology since my first day at STAT pretty much. It was on a list of topics that my editor gave me when I started, and I was like, well, I don't know anything about this, so let me start emailing people. And I think that mental health tech is in a really fascinating place right now. The rise of autonomous therapy bots for consumers is a super weird clinical area that falls into fuzzy regulatory territory, and there is no clinical evidence about it. And I think that's like a major.
And human
Just makes
therapists
things seem
have very different perspectives about it. It's not what you would necessarily think. Like people are not all in one category on it, I would say.
yeah.
It's not an easy one to just like, oh, everyone thinks this. It's not the case.
Yeah. I mean, and nor should we expect them to. There are like what, hundreds of thousands of these
Individuals.
professionals. They probably have, I in reporting on clinical AI, it's like you ask, I've talked to a bunch of doctors about it. They don't all feel the same way. They have different opinions. That's why we talk to lots of people. But it's super interesting. I think on that front, I think something that, and I spoke to this earlier, is something I think is really important and kind of an animating aspect of my reporting throughout this is just proving that any of this digital health stuff works. Like the evidence is light a lot of the time, and I think it's important to like actually interrogate the evidence, to demand the research that illustrates that things work, because one, we shouldn't pay for things that don't work. Two, it's worth knowing which things work, because we should make those things as widely accessible as possible. And until we have evidence that things work, it's very hard to get insurers, consumers, CMS, anybody to pay for them. And so that's just like, I've been beating that drum since I got here. Like, does this work? Does this work? Does this work? And everybody has like these, skimpy little studies that don't show anything.
Sure.
And I think, I think we like, and in some ways it is tied to like what the administration is trying to do with the access models. Like, show me results and I'll pay for it,
Yeah.
And I think that's where we should be heading. If you look at like, this is not an endorsement of their work, but if you look at like what PHCI, Peterson Health Technology Institute last week put out their performance-based contracting playbook, which is, again, I'm a reporter, I don't have opinions, but it seems like it's better to pay for things, that paying for things after they have demonstrated outcomes to your population, instead of just paying for them because they seem like a good idea, is like a reasonable way to go about things.
Yeah.
Well, yeah, I mean, I'm a big fan of the cost plus model for my own work personally. I'd like to be reimbursed for cost and then plus a fixed amount for everything I do. But the reality is, like, we have a serious problem, like you said, around evidence. I think access is a real, push in that direction. TBD, I think people are about to be really shocked because the numbers aren't out there about what they're actually going to pay, and they're not going to pay what it's going to cost to like deliver like bespoke human hands-on services. They're looking for digital technology first, potentially AI interventions that can be done without a full-time human care coordinator as part of a bigger sort of risk model. Lots of challenges to making that work in practice, but we'll see.
Well, Mario, what does work? What have you, like, you've been reporting on this, like, what works? Like, because I have been responsible for some of these report outs where the numbers are fuzzy.
I don't know. Drugs work. GLP-1s work. Like what's been, we've tried, for 30 plus years to do things with behavior change on the obesity epidemic, and it took a drug to actually bend the curve. So I think, and I'm speaking specifically of behavioral interventions here, I think there are lots of really smart like interventions that you can put into the healthcare system that can reduce costs and improve access and outcomes for, there's like really no-brainer stuff. Like, I mean, not to be too much of a shill, but like the old Chris Klomp, like let's connect, or you worked on collective health, right? Or collective medical.
Like, anything you may have read or heard, I was responsible for.
I don't know, some of those ideas, like there are lots of examples of care models that do work, but I just think that a lot of the digital health companies that have gotten the most action are like, can be light on the evidence that they actually deliver value.
Agree with that.
I mean, one thing that we know works, that we have pretty good evidence works, for example, is RPM for like titration for
CHF.
Or not even just for like getting people to target on hypertension medication. Like, there's pretty good evidence for that, but also for congestive heart failure. There's a couple of RPM like limited interventions that have pretty good pretty good track record. So,
Yeah.
there are things that work. It's identifying those things and scaling those things. That's like the goal, right?
Yeah. It's tricky stuff. Keep us informed, as we do not often look at real evidence on the Health Tech Talk Show. So,
yeah.
Only fake evidence. That's right.
Well, it is almost time for the weekend here on the East Coast, where Lisa probably still has to do some business over there in her corporate office building. But Mario,
Friday.
what would you like to leave all of our loyal fans with?
Well, I think the audience for this show is pretty plugged in. I think a lot of times, reporters rely on people telling us stuff for know what to cover and on information about what is going on in the real world. As I said, I'm not a doctor. I work out of my house in Brooklyn. I try to avoid going to the hospital because that usually means I'm sick or injured or otherwise, or my kids are sick or something. And I need, we need to know what's going on. And so, reporters are your friends if you know stuff or you think we should know stuff. Reach out, say hi.
Yeah, awesome. Mario's on Signal. I think you can find everybody at Stat News on Signal. So give him a shout.
Yeah.
Give him a shout. All right, Lisa, any parting words before you have to go back to work?
No, just everyone should note that, my Stat News Stat Plus subscription is a real one. So, that should be an endorsement for you.
Yeah. We reported on all of your reporting on the United series. Oh my gosh.
Exactly.
Listen, you need someone to show
you want
up
ideas, you want actual information. Here you go. This guy. Thanks, Mario. Thanks, everybody.
For coming on the show.
We'll see you in the real world soon. Okay.